Don't be afraid to get out and have some fun in the sun. The sunshine vitamin D is essential for our good health. And we already know that vitamin D can help prevent cancer. And now a study shows that if you already have cancer, vitamin D can increase your survival rate as well as promote longer remissions. Now, another new study from Northwestern shows that aggressive prostate cancer has become so prevalent in men with vitamin D deficiency that all men should have their vitamin D levels checked annually.
Right. Women should have their vitamin D. Everybody should have their vitamin D levels checked because we have an epidemic of vitamin D deficiency.
In fact, it's so important in men in particular that if they have a low vitamin D level, it could increase their risk for prostate cancer 4 to 6 times.
Right. So what we're looking at here is how do we get more in the way of sunlight so that we can avoid this? And typically, we don't pay attention to the time of day because we don't think about that. But the UVB rays that are required to make vitamin D in skin are only present between 10 and 2. And that's only in the summer and a bit of spring and fall. So unless you're out at that time with your skin exposed, you're not going to make much vitamin D because it doesn't go through your clothes. It won't go through sunscreen. It won't go through glass or fog or smog. So you've got to be in the sun for about 20 to 30 minutes, depending on the darkness of your skin.
And if you're darker, you might need maybe an hour.
Yeah, you might. If you're really dark, you might need up to an hour.
And then when you do put on a sunscreen, make sure it's a healthy, organic sunscreen.
Exactly. Well, there was a study that was done in the Journal of Clinical Endocrinology and Metabolism in April of 2014 that showed that the Chinese Academy of Sciences in Shanghai studied 17,000 patients, Vicki, and the vitamin D levels were linked, as you said, to survival rate and longer remissions. And this was a meta-analysis, meaning they looked at 25 studies and vitamin D levels, and they tracked survival. And what they found is that an increase of just 10 points increased survival by 4%. So it's a big thing.
Well, too, the strongest link with vitamin D deficiency is breast cancer and lymphoma. Isn't that right?
Absolutely. And it's also found in some other conditions as well, but not as much. So we're looking at some other conditions like lung and gastric and prostate and leukemia and melanoma, but they're still related to it. So it's something that we should pay attention to.
Yeah, it's pretty scary, and it just seems like it's so simple. I mean, if you can't get in the sun, say you live in Alaska or some other place where you don't have much sun in the winter, you can always take supplements with food.
Right. Well, it's amazing how Mother Nature takes care of us. Those people that live in areas that are more north, like the Scandinavians, tend to have lighter skin. And of course, they don't get much sun there. And in the equator, they tend to have darker skin. So it balances things out. And what this is pointing out is there's another aspect of lifestyle. Lifestyle is the most important and most powerful medicine we have. If we live like Mother Nature wants us to, and we follow a healthy lifestyle with diet, exercise, stress, sleep, weight, and finding joy in life, chances are we're going to do pretty well. And that applies to most of the chronic diseases that we see today. So we should pay attention more to lifestyle and a little bit less to some of the things that we scramble to do once things go wrong.